As far back as 1999, Merseyside Fire and Rescue Service realised that poverty, social exclusion and health inequalities could no longer be allowed to have the impact on safety in our communities. It was time to widen our agenda, to increase our knowledge and understanding of how we could help those most at risk. And so it began, with community firefighters on the front line. We simply could not ignore the fact that health inequality is a root cause of fire. Once you arrive at that conclusion, you cannot operate in the old way. You have to innovate, you have to change, you have to think and act differently. And that is what we've done. Thinking and operating in new ways means being proactive. It entails active engagement in our communities, looking for the early signs of health and social inequality before they can impact on physical safety.
The advocate role at Merseyside Fire and Rescue Service, working alongside operational firefighters, is truly forward-thinking and targeted. The role is constantly evolving.
We're trusted by our communities. We can gain access in ways that other services may find difficult. We're trained to assess signs of inequality, and what's more, we share information in unique ways, ensuring the key issues are signposted to the relevant agencies.
We're working with the fire service, sharing information about the more vulnerable people in our community. We can divulge to them the people who might benefit, for example, from fire safety checks and support, and they go out and deliver.
By crossing the threshold and making people safer from fire, there's an opportunity to assess other needs.
Once we've signposted people to the relevant agencies, we make sure that something gets done.
In real terms, our advocate programme has a measurable effect on the well-being of our communities. It means that our entire Home Fire Safety Check programme is a platform for establishing contact with the community and making positive lifestyle change. In every area of social and economic inequality, poor diet, smoking, alcohol, drug use, poor housing, young people, we're there and we're a positive influence. That's why we're recognised as a world leader in the delivery of community safety. In order to reach the most vulnerable, we've aligned our strategies with the Primary Care Trust health agendas. So our Start Right programme, which addresses weight management for 5 to 8 year olds, directly underpins national needs to tackle lifestyle issues upstream. Our FireFit scheme encourages pupils who traditionally avoid competitive sports to circuit train in a fun and different way. And running All Fired Up, a referral-only course which tackles lifestyles linked to childhood obesity. We know from our innovations over the last 7 years that intervention has a positive impact on health inequalities, especially for young people. But recently we've taken this even further. Our embedded firefighter scheme has grown from strength to strength and has played a key role in the reduction of violence towards firefighters.
The contribution to school life is immense. It's part of a long-term commitment to both the school and to the community in creating a healthier, safer school environment.
With Drive to Arrive, we're reaching out to a range of young people, but in particular the programme deals with the higher instance of road traffic collisions among 16 to 25-year-olds. It contains opportunities to engage and then challenge the motives behind road offences. Other initiatives are building on the groundwork of existing good practice, such as street cage soccer, which not only provides high energy exercise, but also provides a community focus and sense of teamwork. Our work with the Prince's Trust encapsulates the strategy to challenge health inequalities. Our promotion of social inclusion means that young people can learn about the real dangers of smoking, drug and alcohol abuse, as well as matters of sexual and mental health. As a beacon service for older people, we have a broad and inclusive policy as part of our strategy for healthier communities. And you can see that directly in key projects, such as the Heartbeat Partnership, a tailored exercise regime for those who have ongoing heart conditions, or our partnership scheme with social services, Pop-In, designed to access the most vulnerable older people in a drive to keep them healthy and independent in their own homes.
We believe that the joint working between the fire service and the Pop-In team has enabled older people to live safely within the community.
came out and they said they had lift services. Within about 3 weeks, I had a lift. It was absolutely fantastic.
Merseyside has specific underlying issues affecting the well-being of individuals and the communities they live in. For example, we know that smoking is a main source of fires in the home. We are also aware that our region has one of the highest rates of lung cancer in the UK. So our partnership with the Roy Castle Lung Cancer Foundation recognises the need to have an impact on both of these issues. By working closely with other areas of expertise, we can share knowledge and data, promote healthier regimes and, in the long term, build stronger, healthier communities.
One of the key goals for Liverpool PCT is to reduce health inequalities in the city. We commission a lot of our stop smoking services from the Roy Castle Fag Ends organisation. The fire service is a key partner for us.
And partnership can have other creative dimensions. For example, by working closely with landlords and housing organisations, we can coordinate comprehensive home fire safety initiatives. All the time, we're building on the support and trust with residents who see the Merseyside Fire and Rescue Service uniform as standing for more than just fire safety.
You can't focus on people in isolation. However, if your neighbourhood has real problems, say fly tipping, arson, or it may be a family with housing needs, then these are issues that we can resolve. Creating a safer, stronger and healthier community is what we're about. Indices of multiple deprivation shows that Merseyside is a health deprived area, and we're the link on the ground between those communities and our partner agencies.
As a fire and rescue service, we're very often asked why apply for a beacon council. It's not usual for a fire and rescue service. I think our most common answer is why not? As a fire and rescue service, we suffer at first hand with our communities the real trauma of fire. And the causes of that, poverty, deprivation and poor health. And if we don't get involved in dealing with the causes of fire, then we're really not giving value to our customers. We have fantastic people who enjoy public credibility, the respect of our community, so why not get involved in issues such as young people, older people and reducing health inequality.
We know that our work across every strand of community life on Merseyside is already making a difference. A chance to become a beacon once more will give us the opportunity to help maintain and extend the health inequality agenda. We will ensure that our primary care trusts are fundamental partners in the dissemination process. It will also bring us closer to the heart of fire safety and closer to the safer, stronger, healthier community we strive for.